Again, we're talking with Dr. Courtney Talinski from the Zarlengo Foundation Learning Evaluation Center. And I just want to talk to you about the process. So I have a kid and I think they need to get tested. What do I do? What is the process of getting them tested?
So it always starts with a call, right? You'll call and talk about your initial concerns. So my child has been in Orton Gillingham tutoring for 6 months and they're still struggling with reading. Is now a good time to get them tested? Or I would like to get them tested so that we can see where their learning strengths and challenges are and then figure out what supports they might need for school, whether that's a 504 or an IEP, right? So we take your information down and then we schedule an intake meeting, right? And it's really a developmental history. So we'll go through your child's entire history. We start at the pregnancy, right? So just very early on, and we talk about family history as well, but we want to see, were there any concerns during the pregnancy or early development? Did your child meet their milestones on time? So language and physical milestones. And then we ask about medical concerns because a lot of times kids have a history of ear infections or sometimes they have head injuries or it's difficult for them to sleep, right? So all those things are important information for us to gather collectively. And then we ask about their behavior. Do you have any concerns there about their attention or their anxiety, things like that. And then we ask about school experience. So talking about what supports they've gotten in school. Have they gotten any intervention support? What does that look like, right? Do they see a counselor, right? So we're asking for those types of things to really get a good understanding of your child as a unique individual and your family circumstances and what the school environment looks like. So from there, we come up with an evaluation plan. And the evaluation plan, it usually consists of a cognitive assessment, right? So an IQ assessment, and that looks at a child's verbal skills, their nonverbal skills, right? So their problem-solving abilities and their visual spatial skills, looks at their memory, so their auditory memory and their visual memory, and then it looks at their processing speed, so how quickly they pick up information and how well they can execute simple tasks. From there, we do, depending on the kid's age, we do executive functioning assessments. So we're looking at, can a child plan and organize? Can they sequence information? Can they multitask, right? And all of those things are so important in a classroom setting, especially when you're having to manage a couple different sets of directions, or if you're doing a math problem and you need to do various steps for it, right? So we're looking at all of those things. And then we do a reading, writing, and math assessment, so a broad academic assessment. And even if you're just concerned about reading, we want to look at math, right? Because we want to see, is there an area where your child is performing within the average range or above, right? Does your child have a strength? Because usually with a learning disability, it's a pattern of strengths and challenges. So they're struggling with some things, and then other things are typical or stronger for them, right? So we're looking at, is there a specific weakness in an area? And for some kids, everything is a weakness, right? Everything is really hard, but for most kids, it's usually in pockets of their academic development, like reading or writing. And then we'll do a social emotional assessment. So usually that's a broad social emotional screener, looking at things like attention and mood, their adaptive skills, so things like that. And we like to get input from the teacher and parents as well to see what is going on in the classroom and then what's going on at home, because sometimes those two settings look very different, right? Yeah. So that is our assessment. It's pretty thorough and comprehensive. And then, of course, if the child has concerns in a specific area, we'll do more what we call narrow band assessments or targeted assessments. So with reading, we'll look at phonological processing, so how they hear sounds and put sounds together to form words, and how quickly they can recognize letters and numbers and things like that for fluency. And then we look at their oral reading. Sometimes we look at their writing or math. So it really just depends on the question, but we'll come up with a specific plan and make sure that you're on board and you know exactly what we're doing.
Okay.
So that testing, it's comprehensive. Yeah. So it takes a long time. Yeah. We take a lot of breaks, especially for younger kids. Sure. Sometimes we'll do it in 2 half days, or sometimes we can do it in a full day if kids are older.
Sure.
And just put a lunch break in there.
Yeah.
So after the testing, then the psychologist will score up all the results. They'll get all of the feedback from the teachers and from parents, and they'll put together a comprehensive report. right, where they explain all of the results and kind of integrate it into a picture, because we want to make sure that anyone who's reading that report understands that, this is a unique child with a unique learning profile, and they have both strengths and challenges that we need to address and acknowledge, right? And from there, what kinds of supports do they need, right? So at this point, we'll send you the report. You'll have some time to go through it, and then we do a feedback meeting. So we'll walk you through the report and talk about what we found, and more importantly, what it means, right? What does that child need from there? So a lot of times we're recommending one of two things, either a 504 or like an accommodation plan. So these are things like, does the child need preferential seating? Like, do they need to sit in the front because they're so distracted? Do they need different seating accommodations? Like, do they need a wiggle stool or something like that? Do they need extra time on their tests, right? And especially for older kids, like standardized assessments, like the ACT or state assessments, it's really important. So they are not feeling rushed. Those tend to be the big things like audiobooks, just anything that a teacher can easily accommodate because they are shown to have that challenge. Now, an IEP is a little bit different, right? These are special education supports. So if a child has like a moderate to severe learning disability, they generally tend to qualify for an IEP, right? So moderate to severe, in talking in percentiles, it's like the 10th percentile of kids or below, right? So it's pretty significant. And these kids need explicit academic instruction as part of their school programming, right? So they might be pulled out, so taken in a small group with other kids to work on specific learning needs like reading or writing. Or sometimes the teacher comes into the classroom, we call that push-in services, and they'll work with a small group of kids to give them the supports they need. But an IEP can be for a lot of different things. It can be for academic needs. It can also be for speech, OT, or social work, or psychology services. So it's pretty broad-based, but it's really, does that child need targeted supports at school, right? Or can they just get by with some accommodations, right? Those are the differentials that we're looking at. And then sometimes we recommend therapy or outside tutoring, executive functioning training. So there's a lot of different things that we might recommend as part of that process. And we really try to guide you through that process so you know when you leave that meeting exactly what the concerns are and how to help your child.
So then I would take that report to the teacher, to the school, and say, here's what I did outside of the school, and then the school has to accommodate those things or has to work with you on making some accommodations depending on what you've recommended, correct?
Right, So you would say, I'd like a meeting, right, to discuss the report, and I'd like to set up a 504 plan, or I'd like my child evaluated to start the IEP process. And the schools have their own processes, so they don't always take the report blindly and say, okay, we'll do all these things. They need to do their own set of procedures. To make sure that aligns with their district's mission. But yes, you would take that and request that meeting and then go through the steps from there.
Okay. So the benefit of having a kid tested, I mean, we've kind of talked about it broadly, but the benefit of the kid getting tested from what I'm understanding is that it gives a better understanding of how this child is learning, and then how we can make school not easier maybe, but just easier to learn. So we can make learning process easier for this child if we have a better understanding of how they're learning. Is that a fair assessment?
Right. That's a big thing, is where are my child's strengths and challenges, and what specific supports do they need to thrive, right, and to do their best, right? If they need extra time to show what they're truly capable of, then we need to give them that accommodation support. But it's really about meeting the child where they're at and providing them with the additional supports so that they can continue to grow and thrive ultimately. Yes.
Courtney, I want to thank you for being here today and talking with us about all this different information about testing a kid. And again, you are the director of the Zarlengo Foundation Learning Evaluation Center. And the website is?
It's www.learningevaluationcenter.org.
Okay. And you are a multidisciplinary testing center, right?
Yes, so we offer speech evaluations, occupational therapy, and then the psychological testing.
Okay, perfect. Well, thank you again for helping us out today.
Thanks for having me.
Yeah. We hope you enjoyed this conversation with Dr. Courtney from the Zarlengo Foundation Learning Evaluation Center and found some tips on what to do if you think your child might be struggling with a learning disability, the different things that you can test for, and then how to get that evaluation process started. We're excited to have you join us for our next conversation. And remember, it may be hard right now, but one day your child will change the world.